We cannot commodify and commercialize the provision of healthcare services because people fall sick and they need to be treated, they need to be attended to. So it's not a matter of that should be taken from a purely commercial point of view. It should be taken from a public good perspective. And that is why in this country, there are steps that have been made towards including healthcare as a public good. So for example, when you see efforts being made by the government, both the national and the county government, to roll out the universal health coverage, not healthcare, but health coverage, to ensure that we all have health facilities within reasonable reach and fairly affordable. Programs like the Knchr and all this, we are recognizing increasingly as a country that when it comes to our health, it's not a matter of choice. It's a matter of what your body requires you to do at that point in time, and you have to attend to it. So I hear the conversation and discussion about the bottom line, especially for the private sector. But again, we need to adequately invest in our healthcare system so that no Kenyan should actually be reduced into what we call that catastrophic spending because they fell sick. Good efforts being made, but we need to do a little bit more. And I say we need to do a little bit more because let's look at our health budget, for example. We have a standard that was established by African countries, and Kenya participated in the setting of that standard, the Abuja Declaration, which says that governments must commit at least 15% of their budget to healthcare. What is the reality in Kenya? The budget has never gone beyond 5%. In fact, it's hovering between 4.2 to 4.8%. So even in terms of investing in our health sector, we're not doing enough. So the starting point, good efforts, but we should invest as a matter of priority in those areas that we consider to be public good areas sufficiently so that our citizens are not forced to do what we saw one Murage Boniface doing, where the indignity of not being able to pay for healthcare facilities and services turns people into taking choices and decisions that shouldn't be choices or decisions to be taken at all in a country that talks about the dignity of all its citizens, especially in line with Article 28 of our Constitution.